Hello, I'm Dr. Vanita Rattan from the Hyperpigmentation Clinic. So we get asked all the time about periorbital hyperpigmentation, also known as dark circles. So the question we get asked is, I have hereditary dark circles. My whole family have dark circles. Is it treatable? Now the answer is yes. It's a little bit like saying I have diabetes that runs in the family, or I have obesity that runs in the family. It's a genetic tendency. You can change your environmental factors in order to change the outcome. So how do you recognize dark circles? It's a bit of an obvious question, but it's symmetrical. It takes place above and underneath the eyes. And it tends to happen in youth. It tends to get worse as you get older. Now, the reason that this happens is that the melanocytes are triggered when you're younger. The cells producing the pigment melanin. However, as you get older, the skin thins. And as the skin thins, the pigmentation looks worse. So that's basically what's going on here. So the question people ask is why? Why has it happened to me and not to other people? And there's two main reasons. Number one is that the melanocytes in people who have dark circles are just easier to trigger. So there's a tendency for that to happen. But the second thing is that the melanocytes in those people tend to be clustered together. So it's about the distribution of the melanocyte. And those, again, take place on top and underneath the eye, which is why, of course, it leads to the dark circles. Now, the question also we get asked is, how do I treat it? How do I know that I have periorbital hyperpigmentation? How do I know that it's not because of volume loss or something else? So what we tend to recommend is do something called the stretch test. So you basically just stretch the skin under the eye to see if the pigmentation is still there after you stretch the skin. If the pigmentation is still there, then you have periorbital hyperpigmentation, in which case you would come to the hyperpigmentation clinic to treat the skin. However, if the pigmentation goes or the shadowing effect goes as you stretch the skin, in which case you're more likely that the issue is volume loss, in which case you should really get a filler. A filler is a fantastic treatment for this issue. So it's all about identifying the issue and then treating the cause. So I hope that helps you. Please carry on messaging me so I can carry on answering your questions. Thank you.